There's a lot of good news about dental implants. They're 95 to 98% successful. They are a mainstay in mouth restorations at this point. There's many different brands, there's many different ways to place implants, and they've solved a lot of problems that we had. We're able to keep a one-tooth problem, for example, or we're able to restore someone's whole mouth without having to go to dentures, which are uncomfortable or loose or they're decreased in function. So the good news about dental implants is that they are very successful and in most cases relatively pain-free. There's a number of things that can make a situation less likely to succeed. We at Sundance Implant Periodontal Center, we want to take as many steps as we can to ensure success, to keep you out of the 5 to 3%. If I was a patient and I was going to go get a dental implant, there's basically a list of things that I would look for. One of them for me is what brand of implant are they placing? Is this a mainstream implant company that's going to be around for the next 30 years? Am I going to be able to get my parts replaced? What kind of long-term studies are on the implants? Most implants, regardless of the brand, will integrate, but how does the bone maintain? How does the soft tissue maintain over time? I would ask also what kind of materials that they are integrating with the implant. There's 3 parts to a single implant: the actual crown, the connector piece, which is called an abutment, and the implant. So I believe that you should have the implant brand and the connector piece should be the same brand. Number 3, I would ask about the level of experience, and that one could be tricky because very few people will tell you, hey, this is my first one, or this is my 10th one, or something like that. They'll assure you that they've had the proper training, and they may have. I don't want to disparage anything like that. They may have. But those are pretty much the 3 that I would focus in on, and just see what they say. Those are important things in my mind to stay out of the 3 to 5% failure rate. If you've had an implant failure, doesn't mean that you can't have an implant. It just means that case didn't go as well as planned. Implant therapy has changed significantly, even since I've been out of school, which is 10 plus years from my residency program. We know the thickness of the bone, we know where nerves are, we know where undercuts are. We are able to appropriately plan where the restoration is, get the implant in the appropriate position. So it's, long story short, with technology is concerning dental implants, it's changed significantly. And some of the risks that we had to take before just don't need to be there. If you have any questions about dental implants, please come in. We offer a free consultation and we can come up with a plan to lead you where you want to go with your oral health at Sundance Implant Periodontal Center.